Hello, folks, and welcome to our Alumni Insights Career Journeys in Naturopathic Medicine. So today is part of our virtual fair series where we host various different events with alumni, admissions folks, and students to help you see yourself hopefully in some of the careers that our graduates aspire to and complete. And so with that, we're going to start today's webinar. So just a few housekeeping items before we get going. So all attendees are going to be in listen-only mode. If you do have questions for any of the speakers today, we ask that you please use the Q&A function so that we can track if we're answering your questions and as they're coming through. You can throw in the chat where you're joining us from today or answer the poll as well. But for any actual questions for any of our speakers, please do use the Q&A function. We are also recording today, and we will share that link when it is ready. And if you have any questions, as always, please feel free to email us at info@AANMC.org. So just a disclosure, today's webinar is not for continuing education purposes, and we are not promoting any products or anything like that where there would be a conflict. So our graduates here today come from the accredited schools that you see on the screen. I'm super excited to have from Bastyr University, Dr. Hannah Gordon, from CCNM, Christy Graham, from NUHS, Keenan, Dr. A from NUNM, Winston Cardwell and Terrence Manning, and then from Sonoran University, Jeanette Massette and Cassie Wilder. So thank you all to our alumni who are here to talk with you today about their careers, and we can turn it over now. Next slide. All right, so we can do like Brady Bunch version here with the slides and just feel I can call on you, or you can raise your hand if you have something specific you want to answer for the question. And not all alumni feel free that you have to answer every single question if you don't have anything else that's substantially different than what's already been said. So with that, I'd love to talk about inspiration. What was the aha moment? How did you know that naturopathic medicine was the right path for you? And I'll just call on Christy first because you're the first one on my screen.
Thank you. I'm glad to be here. So for me, I never had any exposure to a naturopathic doctor growing up, and it was in university. I was working in a lab that focused on diabetes in children, and it was shocking at how many of these children at such a young age were just so sick. And we focused as a research group on the preventative measures that had a really significant impact on prevention, but also reversing their metabolic profiles. And so for me, it was sort of this moment of like, wow, preventative health is so important. We actually have the capacity to give so much information and knowledge and power to these parents and families to benefit the health of their children. And so I sort of, had a few friends who said, have you ever thought of becoming a naturopathic doctor? I feel like it would resonate well with you. And as most of us did back in the day, we Googled to find out what that might entail. And it was like a light bulb went off for me. It was a kind of a visceral response. And I said, yep, that's what I'm going to do. That's what I need to do. And I never looked back.
Thank you so much for your answer. Dr. Cardwell.
Thank you, and welcome everyone. Similarly, I didn't grow up with naturopathic medicine and didn't know what the term was, and but did grow up in the Southeast United States, and there's a lot of natural healing. I grew up in the 70s, and so there was a little bit of that layover from the 60s and 70s from my mom wanting us to be healthy kids and not allowing us to eat sugary cereals and things like that. But as I got into college, a woman very close to me, kind of like a grandmother of mine, had acute arthritis. She'd been very, very active, and she had never had any problems, and she was bedridden almost overnight. And no one was able to really help her, give her much relief. Conventional medicine wasn't doing much for her. So out of desperation, I went to a herb store in the town where I went to school, and instead of selling me a whole bunch of different things, the owner of the store took me into the library area, and we opened up books and looked through things that would be helpful for arthritis. And we started on a handful of things, some herbs, some diet changes, some exercises. And within about 6 weeks, after being bedridden for about 2 months, she was able to walk up and down the steps without issue. It really, literally recovered her almost overnight, it seemed like. And she lived another 15 years without issue ever again. And so that really inspired me. I didn't know anything about the practice, and I knew I didn't really want to become a food store attendant. But my girlfriend, my wife now, told me about naturopathic medicine. I flew out to Oregon and did a student for a day, fell in love with NUNM, and the rest is history, they say.
Lovely. Dr. Wilder.
A similar story to Dr. Graham of I've always wanted to be a doctor my entire life. I had a short stint of wanting to be Elle Woods, and decided that law was not the right fit. And then went to a conference, and I had done a lot of work to like prepare my application for MD school, to do the MCAT, to actually get interviews at my local in-state schools. And when I went to the one thing I felt like was really missing from a lot of those experiences was like, why aren't we asking our patients about, their diet? Why are we not asking them about their exercise? Why are we just referring out to all these specialists, sending them for scopes, sending them for all these procedures, but we're not actually asking why? It kind of felt like we were just passing them off to the next person on each round. And then I went to a conference on methylation genetics and how to use diet and supplements, and how genetics can push things like neurotransmitters and affect detoxification and how you detox heavy metals. And I was just like mind blown at the fact that you could use medicine in such a creative, outside the box way. And I decided to figure out who the speaker was, learn more about her credentials. I may or may not have sat by the shuttle bus and waited until she got back on it to go to the hotel, and had a really wonderful conversation with her. And she was an ND who went to a Canadian college and lived in Canada. And she told me all about naturopathic medicine. I applied, that was in October. I applied in November, got in December, and started in January at what was SCNM prior, Sonora now, and the rest is history.
Thank you for sharing. Dr. Gordon.
Yeah, so I'll start. Career is a cardiac nurse initially, hospital. So I love being in the hospital. I was also a pre-med degree in combo with nursing, so kind of figured I would probably bridge to provider type. Uh, and on the floor, we did these incredible procedures. I think medicine and cardiac history, right? Like we do tons of life-saving procedures. It's really, really cool. But the afterwards, I would say we don't do a great job of. And so after a couple of years on the floor, I was like, why am I only teaching about certain meds and we're not talking about sleep and diet and exercise and social stressors that are going to impact a return? And like, let's decrease hospital admissions, which we're all getting, more and more focused on these days. So I think with that, that was kind of my transition into wanting to look at a different way of medicine, looked at all the different types of degrees, and then was fine, landed on naturopathic medicine. I went and visited the school, and I was like, oh, this actually helps answer more of the questions that we need in medicine. Anytime I'm talking at other conferences, the biggest thing I think is missing in medicine is health promotion and teaching and empowering patients. And so I think naturopathic medical school really does a good job of that and really focuses on empowering those individuals. So
Thank you. Dr. Keenan.
Hello, everyone, and thanks for having this. So mine is very short, actually. My whole life, I knew I wanted to do medicine since I was a kid. And then growing up, the system was really broken. I noticed that nothing's being into the root cause and being solved. Simple as blood pressure, thyroid stuff. I seen it, and I'm like, that's not the medicine I want to do. I didn't want to do surface medicine. I wanted to dig deep, get to the root cause. So I didn't know about naturopathic medicine until later on in my life. And I had a biology degree with a minor in chemistry. I was looking into get into a master degree or something like that to get into a more holistic mind, body, spirit kind of thing, medicine. But then found out about naturopathic medicine through an advertisement while I was looking up the benefits of honey at like 7 o'clock in the morning. And it's just, it was fate that I was like, this is tailored just for me. So I didn't really find naturopathic medicine. I'm a believer that things happen for us, not to us. So it found me, and the rest is history as well. So
What a
pretty
sweet surprise. Sorry, that was a bad pun.
oh, that's good.
Dr. Musset, please.
Hi everybody. It's such an honor to be here. So for me, although I didn't grow up in the 70s like Dr. Cardwell, my mom was like making medicine, from the kitchen. So her like version of cough syrup. So I knew that food can be powerful medicine. And then we went to the hospital if it was, something like serious. So, but I didn't know that there was a profession where I could, actually learn both. So when I discovered naturopathic medicine, I was like, ta-da, this is where I need to be. So, yeah, so I chose naturopathic medicine because we have a lot of tools and we don't rely on polypharmacy or surgery. We actually work with the body and not against it.
Thank you so much. And last but not least, Dr. Manning.
Hi, thank you. Yeah, my story is pretty similar to a lot of those out there. I had kind of a long and circuitous route to becoming an ND, but I'll try to make it short in the description here. But basically, growing up, I grew up in a very small town in Oregon, and growing up in a small town, we're pretty self-reliant, and we look for ways to take care of ourselves as a community and our health individually. And being healthy as an individual was part of being a contributor to the community. And so just from like my youth, I kind of grew up with this value of health and the role of health in the community. I excelled in sciences. I was an athlete and as I was going through academia, I was definitely on the pre-med track and went to undergrad as a pre-med. But to pay for my way, I worked as a CNA at a nursing home. And, I saw from kind of if medicine's a hierarchy, you have a specialist at the very top and you have a CNA at the very bottom. And so I started at the bottom and saw how the patients were treated, how our elderly were often kind of neglected or dismissed, and just kind of became disillusioned with the conventional medical system and its role in the community. Sure, great at taking care of emergencies and really, really broken, severe, bad things, but like actually helping the health of the community and it prosper, maybe not so great. So I kind of got disillusioned and I decided, well, how am I going to help people? I still want to help people, but conventional medicine might not be the way. Well, what if like I studied ideas and I use these ideas to help change people's minds and live better? And so I went and got a master's degree in philosophy and I realized that's cool and ideas are really great. And trying to understand how we know things and our claims of knowledge is really powerful, but it's not very practical. And while I was in my master's program, there was actually an acupuncturist who had gone to NUNM, and he just happened to be invited to lecture. And he introduced natural medicine to me. And I thought, wow, that sounds pretty cool. It like combines my values with what I could actually do to practically help people day to day. And I looked into it more and I actually went to our master's college advisor, and they actually had just recently published in one of these circulations that college advisors get expose on naturopathic medicine. And I saw that and I read through it and I thought, wow, that's a really viable career opportunity. And I applied. And at the time I was at a school in New Mexico. And so I was happy to be able to go back to the Northwest and get closer to home and family. And I kind of went to naturopathic medicine because it was a good mix for my values and my philosophy, but I didn't really know what the other side looked like. I just knew I wanted to go to ND school once I found out about it, but I'm glad I did.
Thank you so much. So we'll jump into the next question, Stephanie, please. All right, so let's talk workday here. If you wouldn't mind sharing a little bit about what your practice looks like now, what's a typical day of work or week, if you do different things and are in different places, because we always want to share how people are working in the field. What's your title? Maybe a quick snapshot of what you do. So, Dr. Massett.
Okay. Yeah, so Dr. Musset, like Dr. Joanne just said. So a typical day for me is I work 3 days a week. And then I also I'm attending to one of the offsite clinical rotation. I have about, I believe, 10 students that I supervise at the St. Vincent de Paul. And then if I'm not doing that, attending conferences, workshops, and then I also love to create content for LinkedIn. So my day is like a mixture of like science, creativity, content writing, and academic. So
Thank you, Dr. Manning.
Yeah, I too have practice clinically 3 days a week. Pretty standard, kind of 8 to 5 when I do have my clinic days. I specialize in like regenerative medicine and injection-based pain management therapies. So my day is pretty mixed in between a lot of different diagnostic and office visit consults and reviewing imaging, and then also doing procedures that are pretty technical and advanced. Um, but then on the other days, I'm doing a lot of consulting. I also am part of a specialty organization with for injection-based therapies. And so I have a lot of other doctors that I train on my days off, and a lot of them ask for consultations about their cases all across the country. So I spend a lot of time kind of collaborating and consulting with other doctors, both ND, MD, DO, PAs, all, no denomination with that regard.
Beautiful. Thank you, Dr. Wilder.
In December, I stepped back from clinical practice because I own a clinic in Minneapolis, Minnesota. So Minneapolis is a registered state, or Minnesota is a registered state versus licensed, has a little bit more of a limited scope than some of the states out west and even in the east do. So when I came here in 2017, I started my own practice out of just one small little room. I saw as many people as I could whenever I could and whenever they wanted to pay me. So it was a kind of a startup hustle at the very beginning. And then over the last 8 years, we've grown into a multidisciplinary team. PA, NP, ND, started a residency program, and then have just been able to grow the team. And now I serve as more of our clinical mentor, onboarding new employees. And then we also have kind of a training program for conventional practitioners who want to, or doing IFM or other certification programs that want to get a job in integrative medicine, naturopathic medicine. And I oversee a lot of our onboarding and clinical mentorship for those individuals. So my day-to-day looks quite different now without seeing patients every single day. But it is a lot of medicine, researching, keeping your toe in innovation, trying to see what other people are doing, what's coming down the pipeline, how to bring it in, how to create process, procedure, a lot of HR, and then just hopefully one day I'll get back to clinical practice once things seem like they're a little bit more well-oiled.
Beautiful. Thank you, Dr. Gordon.
So my current is I'm a site medical director at a federally qualified health center in Seattle, Washington. So I'm over about 14 providers, MD, PA, NP. We serve about 10,000 patients in our community health center. I had about a 500 patient panel. I just have kind of been switching a little transition zone right now. So I've launched an integrative medicine service line for the FQHC. And so I do that, rotate to our 4 different clinics, fill in for urgent care, fill in for primary care on some Saturdays. And yeah, so it's a little bit kind of 50-50 admin and patient care.
Thank you, Dr. K.
Yeah, so I am a naturopathic doctor and also a chiropractor. My typical day is a mesh between straight up chiropractics, 10-15 minutes, or both chiropractics and nutrition, which is naturopathic stuff, or straight up nutrition. So it's always changing. On the busy days, I see about 20 patients a day. On the slower days, I see less, maybe because it's packed more of nutritional visits, which can take up to an hour, or sometimes more if it's an initial visit. I am part of an integrative kind of clinic. We have 5 doctors on site. I am the only naturopathic doctor, but there are 2 more that do nutrition. There's a sports medicine kind of chiropractor and others. So my typical day is either adjusting or also integrating the physical medicine with the nutritional aspect. But it can be straight up naturopathic medicine. I stay general. I typically use a lot of functional stuff, labs, stool analysis, and or just straight up nutritional advices for getting root cause of things.
Thank you, Dr. Cardwell.
So I see patients Monday through Thursday and have Friday as an admin day. I'm owner of Atlanta Integrative Medicine, and it's a multidisciplinary facility as well. We have a medical doctor, another naturopathic physician, an acupuncturist, a nurse practitioner, several nurses and medical assistants running our IV department. I'm 60% in oncology, so a good bit of what I see is involved with that, whether it be helping patients get through chemotherapy, radiation, surgery, or helping patients with end of life as we're in stage 4 terminal stages. Outside of that, most of the rest is chronic illness, and that's anywhere from birth to the grave. So I see everybody at every age, and I see a good bit of peds because a lot of our naturopathic colleagues in Georgia don't. I do just about every lab known out there, from functional to regular. We cast wide nets when we're trying to find what's going on with an individual. Our typical initial patient visit is about 2 hours, which is our nurse practitioner doing initial intake, and then me following. And the follow-ups are typically an hour for first follow-up, and then 30-minute slots for follow-ups after that. So anywhere from around 10 to 12 patients a day, and that I'm seeing, and then we have probably about 10 to 15 in the IV suite every day, and so on. So lot of different things are moving. We have a on-site pharmacy that dispenses natural products, so that makes things a lot easier for patients to access high quality products. And just got a great team. So I'm really blessed to have a lot of people that are supporting me. We wouldn't be who we are without who we have working with us. So I'm really lucky.
Thank you. And Dr. Graham.
So I am in clinical practice 4 days a week. I have 3 young children, so my schedule is very much based around them and their needs and coaching their sports and things like that. So I work typically like 9 to 3:30, 9 to 4, Monday to Thursday. With a focus in women's health. And I do see all the kids in our office. I work alongside 3 other NDs. We all focus in women's health. We see anything and everything, but we all have our own specific niches within that. I do all our gynecologic and pelvic health at the office. Lots of hormone replacement therapy, menopause hormone therapy. So every day and any day is mostly cases pertaining to that. And I'm also an international board certified lactation consultant. I've been practicing as an LC for about as long as I've been a naturopathic doctor. And I do that in private practice under my ND license, but I also work in Ontario. Our publicly funded system is called OHIP. And so I work with an organization called the Ontario Breastfeeding Clinic that provides publicly funded lactation support to patients. Pediatrician calls into every visit that we have with them, being seen virtually across the province or in person. And so I do that typically all day on Fridays, and sometimes I'll take sort of like one evening slot, depending on our schedule.
Thank you. Next slide. Because we have people, we've got a panel here that has so many, you're geographically diverse, you have different ways that you're practicing, different practice settings. I'd love to hear maybe some of you talk about finding your way. How do you, because one of the amazing things about naturopathic medicine is there are so many different ways to practice. And one of the challenging things about naturopathic medicine is there are so many ways to practice. And so a lot of times we hear from students, well, I don't know what to choose, or I don't know how to choose. And how do you find that area that really excites you? What advice would you give to a prospective student in trying to find their way, whether that's specialization or general practice? But if you can provide maybe a little bit of insight on how you did it, or what your advice would be to someone considering the field. Dr. Cardwell, I'll start with you because the squares keep moving around. And by the way, if I don't call on you, just raise your hand because these squares keep jumping around on me and I might lose my order here.
Sure. So, as you probably figured out, a lot of naturopathic medicine basically sets us up and trains us as general practitioners or family medicine providers. So you have exposure to the full gamut, and in that process, you usually will find some areas that you like, and that's probably one of the most important things: is do what you love and what brings you joy. But in reality, be it, you do what seems to be right based on your location, your community need. There's no need to set up a pediatric practice in a retirement community. So doing things that also, I would encourage you to look at the chronic illness. That's a lot of what we see as a profession, because that's where right now conventional medicine has really no significant answers, because it's so multifaceted and there's so much time involved. And unfortunately, with the specialization of medicine, we have gotten away from the ability to be able to treat patients as a whole and to look at them. So I would say that probably a good bit of what I do that also has brought me success is I act as our office acts as a medical home for a lot of our patients, whether they know that that's what they're getting when they come to us or not. But I don't just see somebody for a toe jam, a problem with a musculoskeletal issue. They come to us and then they start talking about all the other things. And then even if they're seeing a specialist and I haven't heard back from my cardiologist, so let me get them on the phone and see what we can do. So being integrated and enmeshed in the community, both in the medical community as well as with your patients, and helping them out as much as possible is really critical. But also communicating with other providers of your patients, getting to know them, letting them get to know you, and making sure that communication is open has been really powerful. And that's how I get a lot of referrals from my conventional colleagues who have no idea about naturopathic medicine, but they know that our patients are taken good care of and they know that they get results. And the last thing I would be is in specialization. There are a lot of different modalities in naturopathic medicine. Find what works for you. Use something that actually provides results. Patients won't come back to see you if you're not providing results. So whether that be herbs, homeopathy, physical medicine, injection therapy, sometimes you got to go for the jugular initially to get results, and then you work on cleaning up the environment, the diet, and the lifestyle, and all that later. But just keep at it and never ever stop. Keep at it.
Thank you, Dr. Graham.
Yeah, so in Ontario, specifically within Canada, naturopathic doctors can't say that they are specialized in anything, but we can say we have a focus on something, which, if you ask me, is basically more or less the same thing. I think for me, I always knew I wanted to focus in women's health. I actually thought I was going to be a gynecologist from a very young age. And so I've carried that forward with me throughout my entire career. When I was in school, I knew this was an area I wanted to be particularly skilled at. So I sought out lots of different, mentorship opportunities, preceptorships, and then I completed a residency at CCNM with a focus in women's health as well. And then sort of surrounded myself with colleagues who had a similar interest area has actually worked the best for us because we're better in numbers. Sometimes people think, oh, you shouldn't have someone else in your practice who focuses in the same area as you. But for us, it's actually made us a stronger unit in general and has helped to kind of grow all of us within the practice. And we are now kind of the name for women's health. So that for me is helpful. I think you have to choose something that resonates with you and where there's a need in your community. And I think we know now as women age, they're not being as supported with the healthcare that they need.
Thank you. Dr. Wilder?
Yes, I'll probably come at this from a different because I can anticipate that we'll all have very similar advice. But as an employer of other NDs, something that I just noticed and starting a clinic is that if you intend like thinking ahead to what you want your life to look like on the other side, if you plan on going back to a small rural town, the and you're our state doesn't allow us to take insurance as a registered state. So the only option we have is cash pay. So if I was going back to a small rural town in Minnesota, I might not be able to charge as much as I could in a larger metropolitan area. So unfortunately, it kind of dictates how many patients you have to see in a day, how much you charge those people, and how often you work. And if you want to have 10 kids and have them all in sports and do all the things, your ability to work on a day-to-day basis will be a lot more limited, and so your ability to provide will be more limited. So that'd probably be my biggest advice. I would also say the energetic component of seeing oncology patients and chronically ill patients is really heavy. Those patients are very sick and they're very marginalized by the system. They're very passed over. They have a lot of medical trauma and medical gaslighting that they come from, and it's very heavy on the person. So you might not be able to see as many patients in a day as an empathetic provider as someone who's just seeing women's health or pediatrics. Those can be a little bit lighter, they're a little faster, and you can spend as much time with them, but it's not as energetically heavy as some of these other professions. So even just kind of looking ahead and thinking about what you want your life to look like, your working hours, your stress levels, your income levels, where you plan on practicing, I think as much as I would be the person to say, I would echo everyone else to do what you love and absolutely do what it is your heart desires, I would also just be a little bit more critical thinking in what that looks like for you, because you might get to practice and realize that you can't make money or you can't survive seeing the patient population that you just spent 4 years investing a lot of your time and energy into. And you could always go virtual in this day and age, and a lot of people have, but there's such a need in your local community for this type of medicine that you could go nationwide, definitely, but the people right in your neighborhood need it as well. So just thinking critically through that would probably be my best advice. I did start off doing a year and a half with a naturopathic cardiologist, and I absolutely love cardio. It was a wonderful experience, and got out and realized that a lot of older people have cardio and they're a lot slower. They don't fill out forms as easily. I'm very tech savvy and I'm very quick. And so it was just a little bit of a population mismatch that I didn't actually think through as a 20-some-year-old naturopathic student, that I later found out. So I did switch my focus afterwards to go back and get more advanced training and do a lot of continuing education in women's health and hormones as well, because it was a population I just enjoyed being around. And it's a great need, just like Dr. Graham said, but just, thinking through some of those things in the future is probably going to set yourself up for best success. So
Great advice. And knowing yourself, doing aptitude tests. I would add to that, take career aptitude tests, take personality tests, learn all the things about yourself, what makes you tick. And, to Dr. Wilder's point, what type of life do you want to set up? Are you someone who wants to not be tied down to a geographic location, or are you someone who actually revels in that? Like, I think all of those things come into play when you're choosing what types of areas, in addition to what you're good at and what sparks your brain, and the things that you research for fun. What are the things that you pick up journal articles on and research when nobody's asking you to do it. But in addition to that, what is the lifestyle that you want to create for yourself? What is the where do you want to live? What are the types of things that really excite you, and what's the life you're creating for yourself? Because all of that factors into, in addition to the culture of the specialization or areas. Dr. Gordon.
Exposure, exposure, exposure. If you want to be a surgeon, don't go to naturopathic medical school. If you want long visits and want to do chronic illness and all those things, sure, go to naturopathic medical school. But I think we can't learn unless we get our feet in the mud a lot of times, or that's maybe my tactile learning style. But I would just say round with lots of different provider types. We're all needed in medicine, and find what fits. And I think one of the only ways we can do that is really just meeting people and getting personal interaction with those different provider types that deliver a wide variety of care.
It's hard to top those advices. They're really, really great. But I look at naturopathic medicine as a calling. So due to that, it's more of looking inward than looking outward. Although you have to be practical, yes, but eventually it comes down to searching within to see what really moves your gears. Uh, Me personally, I like to stay general just because of the whole holistic approach. And I didn't want, I just look into the future to be narrowed down to one path only when I wanted to treat the whole body and the whole person. So I think it's just going back, looking inward, but you got to be practical. Yes.
I just got goosebumps from that because I too, came to naturopathic medicine by what I felt like was a calling. And um, I came in, I had no expectations of what my career would look like afterward. I had no expectations about specialization or the patients I'd be treating or even where I'd end up. But I knew I had to go to ND school and I knew that that's what I, needed to accomplish. And then the rest of it would just work out. And luckily for me, it has. Some people, might not relinquish control as well as I did in that situation. But I think there are so many different ways to take your ND degree and make a good living doing so while serving yourself and your community to the utmost in a very high integrity. For instance, I went to school totally planned on being kind of more like a well-trained botanist and really love botanical medicine. I can't tell you the last time I prescribed an herb. So it's just completely different than what I entered. But my wife, on the other hand, who I met at NUNM, she's very much a generalist. Like she sees everything, babies to elderly and dying, and she loves it and she loves the diversity and she does a great job at it, and her ND degree affords her that. What I ended up with my specialty, I came to my specialty through my residency. And through my residency, I did a 3-year residency. That's where it really kind of solidified my love and for my specialty. And it really fits my personality where if I really want to help people and I really like to help people, we all like to help people. But for me, if I see it's broken, I like to fix it. And I can do that to a large degree with injection-based therapies. Like there's always a time and a place where we're going to need orthopedic surgery, but there's a big gap between conventional like suppression and cortisone and therapies that are going to hurt the tissues and like actually needing surgery. And so I fill this nice gap, but it means I'm pretty limited. I have to be face to face and hands on with patients. I can't really have a sprawling virtual practice all across the country. And I'm also limited by scope. Certain states, we don't have as good of injection therapy based scope. But when I came to ND school and when I was looking at ND school, I didn't care about any of that. Now, sure, I have to take it into consideration and it limits where I'm going to live. So, but I think it works out and I'm happy that it's worked out my way for me and my wife's way for her.
So good. Thank you. And Dr. Massette.
So for me, because I mentor students, I always ask them a couple questions. Do you want to do residency? Do you want to do private practice? Because depending on what the answer is, then we need to be strategic in terms of starting, even if they're in quarter 10, working towards that goal. So, so if they want to do residency, then there's actually like rubric where what the residency programs like want you to have. So we go through that, and then if you want to have your private practice, then that's a different story, So depending, and then I also ask which state they want to be in. So if they're students and then let's say they want to, stay in Arizona, I encourage everybody to join the association with the state that they want to practice in, get to know the doctors, get to start networking, and then also being visible on social media, especially LinkedIn, start, I guess, making noise, as a student, obviously you can't write anything about like treating patients, but just try to be visible, try to kind of so if like for residency, for example, they're gonna look at all those things, so it really depends on what you want to do. And then also there, if students don't know what they want to do, there are ways to kind of blend the two. So one will be like start learning how to speak. So speaking will get you places. Try to be like visible on social media. So start your own social media like account, So there are ways to do that, but most of all, like I encourage students to learn as much as possible and to have the foundation. And then from there, go to like medical conferences. A lot of medical conferences get to do like I call them like lunch and learns, where they pick like a mentor, somebody who's doing what they want to do, and then take them out for lunch. So there are ways that you can do everything without knowing which path you're gonna do. But the most important thing is being strategic and starting early in your medical, education.
So if there was advice that you would have appreciated when you started as a student, or advice that you would give a student now, what would that be? So we've got a couple questions in the Q&A regarding, what advice do you have for students? What would you tell students? What do you wish you were told? Maybe, you could frame it in that way if you want as well.
Sure. So I would say like having an abundant like mindset. There are a lot of rumors there that naturopathic doctors don't make money, they're not doing well, but that's actually not true. And that doesn't have to be a story. So knowing that you can do everything that you want to do and still be successful, I would say that's number one. I never really listened to that type of mindset when I was a student. I was doing a bunch of things and I knew I wanted to get into my own practice. I didn't know how I was going to do it, but I would say like the mindset is huge. And then second is like having your own voice. I see like in our community, like everybody wants to do the same thing as the other person, but just, like this, naturopathic medicine is such a unique field. And if you're unique in your own way, then it's a strength. And then number three is being visible. So now if you want to be on TV, or if patients want to see you, they're gonna look you up on social media. So being visible is huge right now. And you pick, I guess, whatever platform you want to use. And you don't have to be dancing. You can just show up authentically and people will, come to you. So that's the advice that I have.
Wonderful. Does anyone else want to jump in next?
Real quick.
Sure.
Yeah, just a few things. Learn as much as you can. I know it's a fire hose approach when you're learning in med school, especially in naturopathic medicine. There's a lot at you, but try to take as much as you can, even the supplemental stuff, even the seminars, the extra stuff, because you will get a lot of small information in your storage that you will use clinically later on and help people. And another thing, adapt. Med school for me was every semester you had to adapt to change your learning style, so you can work with what's being presented to you, not just to pass classes, but to store it, because this is kind of what you're going to use later on. So adapt to store as much information as you can.
Yeah, I think to tag off of a couple, just to reinforce, like really looking at the business side. Do you want to work in a hospital? Do you want to work in a big conventional setting? Do you want to run your own practice as a solo? Do you want to be in a multi? Every area can be successful, but you're going to have to do it a little bit different depending on what state you're in and who you know. So same thing, exposure. Go and see, and keeping that positive mindset. Agreed. I think there is a I think our profession sometimes is like, oh, we're not involved in medicine. Da, da, da. No, like we aren't underdogs. We're part of the team. We all are adding something different and really continuing that piece, but really try to look at the business side of it on where you want to practice. And
Yeah, I would echo that also. I've had a few kind of changes. I dabbled with being a clinic owner, came back to being an independent contractor. It worked better for my lifestyle and what I needed at this point in my life. But I really feel like I didn't get much training in school on like business and retirement planning if you are going to be self-employed and what that looks like if you're going to have a family. So as much exposure or additional training as you can, that is for me and has been such almost like as important part as what I do in practice is feeling confident in those other things and knowing how to effectively plan and run a business, whatever that looks like.
I was just going to add to what Dr. Abdelbaki said about learning as much as you can. That is so incredibly important, and starting now. If you are, considering, starting school, don't wait to start school. That's what I was told. Just wait till you get here. You'll have plenty of time. I really wish that somebody had given me all the classics and the list of all the things that kind of go to the back burner, because you're focused on anatomy or biochemistry or just surviving, where you don't have a lot of time to look into the theory. Luckily, I had a lot of what we call elders, that I was taught by, that did instill a lot of the old naturopathic concepts. But I would really encourage you guys to look into the old naturopathic textbooks, and any ND can help you with that. And there's a lot of them out there. And when you're in school, to volunteer at the local clinic, to get work study at the clinics, do everything you can to immerse yourself in the medicine. That also will build up relationships, and so that's another huge one, is to maintain contact both back home or wherever you want to land, with other providers while you're in school. Having those regular check-ins every few quarters or so makes a huge difference if you want to make contact with them down the road. And then we don't residency is there are not a lot of residency slots, and so a lot of times we make our own residencies, versus having them more or less spoon fed to us in conventional medicine. You have to apply, and it's aggressive to get into the different residencies where you want to be, but everyone more or less has a residency. That's not the case. So that's something you can garnish with the relationship that you've had over years with other providers. And the last thing I was going to say, if you take out financial aid, which a lot of students need, be very sure to take only what you need, spend only what you need. Do not spend all that they give you. Live as a pauper, beans and rice for 4 or 5 years, because you're going to have to pay it back. And that's going to make your life so much easier if you can keep that down. Cost of living is certainly high. Cost of education is high, but you can certainly, spend as much as you want, or you can save as much as you can.
I'd just add just a couple things. One thing that, looking back about school, learning is definitely the key, and I maybe didn't take that as seriously at some times, and now I have to go back and look things up, like, oh yeah, I remember we learned that, but like, what does that really mean, or what is this indication, or what's that diagnosis? So really soak it up and just take advantage of that opportunity to learn, and learn as much as you can, and learn the foundations of the medicine. And then the other thing that I kind of overlooked when I was a student was my classmates. And they're going to be your professional colleagues after you guys graduate. Now, they may not be in the same state, or they may not be the same specialty, or not even anywhere close, but eventually most of us, our paths will cross again. And we're all kind of in this together. And I just wish that I would have been more focused on connecting with more of my classmates, and more friendly and collegial rather than maybe competitive. I tend to kind of always be pretty competitive, and I just wish I would have really focused on connecting with people more. And we need each other, and we rely on each other nowadays, and I've seen that, and it's just really important. And then the last thing is, I wish I would have developed better self-care habits as I was going through school and earlier in my career. now that I'm a little more long in the tooth in my career, it's been hard to get back on getting good habits. And I've got two little kids running around and I always make excuses. But as a naturopathic physician, I kind of do feel like it is my responsibility to live what I preach. And I find it kind of hard to do. And I feel like if I started earlier and focus on those habits a long time ago and taking care of myself and my not just physical self, but emotional and spiritual, it would have served me better.
Excellent, excellent guidance. And the one thing that I'll add, in addition to, some of the things about self-care and, looking into all of the different ways, exposing yourself to all of the different practice types, pound the pavement, get to meet as many people, go and volunteer as a student. We have several folks here who are involved in specialty associations. All of them host conferences. There are conferences that you can volunteer as a student. There are so many different ways that you can network and start networking. Like Dr. Caldwell said, you don't have to wait until you're in school to start that networking, and seeking out mentorship and being intentional about seeking out mentors who are doing what you want to do. Find the people who are killing it and ask them out to tea. Ask them, hey, would you mind, doing a 15-minute Zoom? I would love to hear how you set up your practice, or, whatever it is. But really, don't be shy. People will talk to you. They will share but you've got to reach out. You have to take that step and, ask. And I'm sure any of the doctors here, and we'll throw up their contact information in a moment. But our docs are willing to share. They're willing to tell you, and sit down for a cup of tea or a cup of coffee or a quick Zoom and talk about how they did things or what are the lessons they learned. But for sure, if you identify that there's a specific area, start finding the people who are successful. Don't find the complainers. Every profession is going to have complainers. Every profession is going to have folks that are, maybe they didn't land the way that they had hoped to, or maybe this wasn't the right field for them or whatever. But and every profession has that. But go find the people who are rocking and rolling, ask them what they're doing, what's their keys to success, and start to emulate that. Find mentors, mentorship. So if I could leave anybody with anything, that's what I would say, as well, as somebody who's been in this field over 25 years too. So anyway, thank you all for coming. We're going to go to the next slide here, to the contact information. So please feel free to take a screenshot if you want to get in touch with any of the folks here. Next month, we have another event coming up, and we host these free events every month. So hope to see you at another event. We've had some great questions that have come in respect for all of our doctors' times here, because I know they're all busy and they've stepped away from their practices to be able to be with us today. So I want to just honor you. Thank you so much for taking the time to be with us, and thank you to the participants as well for being here and asking great questions. And I hope to see you at another event in the future. Thanks for coming.
Thank you.
Thank you.
Thank you.
Bye, everybody. Good luck.
Bye.